Hello, my name is Diane Stewart. I'm a Senior Director for Care Redesign here at Pacific Business Group on Health. My team seeks better ways to care for patients, ways that improve quality and lower cost. And what I'm going to talk to you today is what we've learned about better ways to care for patients who use the most healthcare resources in our system. When we take a look at the total healthcare spending in the United States, we see that only 5% of the patients account for 50% of that spending. And when we take a closer look at the patients, that 5% of patients who are using most of our healthcare dollars, we find that many of them have chronic illnesses that they're living with every day. Could be a combination of kidney disease, heart disease, lung disease, and they're doing their best to manage those conditions on their own. But even doing as well as they can, they find themselves in and out of the hospital, into the emergency room. They're going back and forth to multiple specialist appointments, managing multiple medications, and some of them are able to do that on their own and some of them are not. What we've learned is that by having them connect and have a trusting relationship with a care coordinator who can help them better manage their multiple illnesses, who can answer their questions between doctor's visits, who can help them, who can really understand what's getting in their way of taking better care of themselves and helping them problem solve those challenges that those people have, that they each have, that it can make a huge difference in the quality of life for these patients as well as for the total spending in the healthcare system. The Pacific Business Group on Health tested such a model with 23 delivery systems in 5 states. And by matching 15,000 patients who had a history of hospitalization and emergency use with trusting care coordinators, we found that we were able to reduce days in the hospital, reduce emergency room visits, and improve care for patients.